Thank you, Barry, and welcome everyone. So as you can see, the title of my presentation is Implementing QA Safely and Effectively During COVID-19. But we must also consider other viruses too. As we are now in a pandemic new world, things will unlikely be the same again, and our style of doing things will be very different for the foreseeable. So what I'm going to cover in my presentation is how the Federation responded to the pandemic, how the sector dealt with it and is continuing to deal with it, and the practical application of dealing with it in relation to key areas of group water scheme work. The name COVID-19 was announced on the 11th of February by the World Health Organization, and exactly a month later, on the 11th of March, it was recognised as a pandemic. But throughout this, water services, including those provided by the group water scheme sector, were recognised as essential services during that time. So how did the Federation respond? We were caught all of a sudden. How were we going to do our job safely? So the Federation responded very rapidly. They prepared a series of advice notes for group water schemes. The first one was published on the 10th of March. It provided advice and guidance to group water schemes and how they would prepare in the event that a group water scheme staff member or a volunteer were to fall ill with the virus. So advice note 2 provided advice on operational management and financial management. Advice note 3 provided further advice on contingency planning and operation of the whole area of operational monitoring. And advice note 4, which was the final advice note, was in relation to the government's return to work safely protocol, and there was other advice for group water schemes in relation to AGMs, annual returns to the Friendly Society and subsidy claims. So all of the advice notes were based on recommendations from the government and the HSE at that time. And they can be accessed on our website. If you're looking for the advice notes or information on COVID-19, there's a section there on our website updated for group water schemes. So board and staffing concerns during COVID-19. Well, the first thing was for group water schemes to identify what staff members or volunteers fell into the high risk category. And if so, the extra care needed to be taken with these members. They needed to follow the advice from the HSE. They needed to stay at home as much as possible. They needed to social distance and make sure to wash hands regularly and properly. So schemes really needed to be prepared for situations where group scheme staff and volunteers were to fall into the high risk category or they were to fall ill with the virus itself. So at least 3 people needed to be trained on how to run the scheme. So the Federation prepared like a traffic light system on all schemes based on risk. So development officers contacted their schemes just to see how they were getting on during COVID-19 and to assess the level of risk. And obviously, if schemes only had 1 person trained on how to run the scheme, they scored the highest risk. Again, it highlights the need for managers on group water schemes, as discussed in previous presentations. And we would strongly urge schemes to consider the whole area of rationalisation, because schemes then can share the services of a manager. So extra responsibilities for group water schemes. So on top of the paperwork that they already have to prepare, there was additional paperwork that needed to be prepared by group water schemes. They needed to implement the government's return to work safely protocol, which required them preparing a COVID-19 response plan. They also needed to review their existing safety statement to take account of COVID-19 measures. So the government's return to work safely protocol, it's a national protocol for employers and workers. It was published on the 8th of May. It requires that each workplace appoint an employee, at least 1 employee, or a group water scheme representative to ensure the COVID-19 measures are strictly adhered to on the scheme. And in order for this to be effective, this person, the representative, needed to have the necessary training to enable them to fulfill this role. So key tasks that all group water schemes must complete to effectively implement the protocol include developing and updating COVID-19 mitigation plans to take account of the protocol, develop or amend policies or procedures to ensure that there's prompt identification of a person that is showing signs and symptoms of COVID-19 and to isolate, develop, consult, communicate and implement workplace changes or policies to staff members or volunteers, and implement the COVID-19 prevention and control measures to minimise risk to staff and volunteers. So COVID-19 induction training for group water schemes. The Local Authorities Services National Training Group has developed induction training courses for those returning to work and including operators and contractors. ICOS SkillsNet also has a range of online courses available, including COVID-19 related courses. So the COVID-19 response plan, as I mentioned there earlier. So the return to work safely protocol requires that a COVID-19 response plan must be prepared. So it must detail how a group water scheme will put in place measures to reduce the risk of spread of COVID-19. So an example of a COVID-19 response plan is our own, the Federation's response plan. This plan gives an overview of the key areas that needed to be assessed to ensure compliance with the protocol and to minimise the risk to staff members and others. The plan needs to be signed by a director of the group water scheme or management. So the Health and Safety Authority has a template of a COVID-19 response plan, and it covers the key areas that need to be assessed. It also is backed up by a series of checklists. Now they have 7 checklists there in total that can be used in addition to the plan. Is COVID-19 spread by water? Well, the presence of the COVID-19 virus has not been detected in drinking water supplies to date, and based on current evidence, the World Health Organization are saying that it's deemed to be low risk. Now, that is the case with this virus. It may not be the case with other viruses, which could be spread by water. So it's therefore extremely important that hygiene standards are strictly observed and that disinfection systems are properly operated and maintained. So as already covered by previous presentations, the distribution network needs to be scoured and flushed regularly and a chlorine residual maintained. And just to note as well, we'd urge schemes that have nursing homes and schools on their network, just to reassure them that all is okay with the water, just in case they would have concerns around the whole area of COVID-19. So where possible, group water schemes should speak to neighbouring schemes about the possibility of working together, just to ensure that there is continuity of supply and that QA is being implemented. They can share resources and expertise and staff if necessary. So we would encourage all schemes to look towards that. Here's Ballyboy Group Water Scheme and Cadamstown Group Water Scheme. They're having a meeting outdoors, they're socially distant, they are actually discussing amalgamation here at this meeting. So again, they can share resources, expertise and staff if necessary in the meantime. So this is just a visual for the control measures for spread of COVID-19 and all viruses, just to ensure that hands are properly and regularly washed, practice sneezing and coughing etiquette, avoid touching your face, make sure surfaces are cleaned and disinfected at all times. And much and all as us Irish love to shake hands and hug, we need to refrain from doing that. And we need to ensure that we keep a safe distance from others, 2 metres apart. So here's a photo of CBC Group Water Scheme. They have COVID-19 signage on the door. They have a sanitising station just inside the door for staff members and volunteers. We have a photo of Callow Lake Group Water Scheme. They have COVID-19 signage on the entrance into the site. They want to ensure that there's social distancing on site. And we have a photo of Killanny Reaghstown Group Water Scheme, and they've installed a Perspex screen in the Group Water Scheme office. So the effect of COVID-19 on normal QA work. So the first thing is accessing members' premises. Now this is how we used to do, checking chlorine residual levels at consumers' taps. Now this is all changed, this can no longer happen. So what we're suggesting is in the short term that group water schemes would look towards installing an outside tap on the last house on each line in the network. Again, it's a short-term measure, it's cost-effective, and it'd be the easiest thing to do as in the short term. But as a long-term measure, what we're suggesting is that schemes would look towards installing a dedicated kiosk, as shown here by Anna Group Water Scheme and Glasslock Ty Holland Group Water Scheme. Glasslock Ty Holland Group Water Scheme have said that this has been hugely invaluable to them. They installed this as part of advice from the local authority back in March, and the caretaker can access this kiosk on a daily basis to check chlorine residual levels. And again, the external sampling company and Monaghan County Council are also able to carry out routine sampling, accessing this kiosk. So we would encourage all schemes to look at this as a long-term measure on their scheme. So travelling within and outside the scheme. Look, operators and caretakers need to travel around their group water scheme, and sometimes they need to travel outside the confines of the group water scheme. So we would say to them, ensure that they have an adequate supply of PPE, ensure that they have masks, gloves, hand sanitizer and disinfectant wipes with them. And if more than one need to travel together in the van, which can sometimes be the case, if it's absolutely necessary and they need to do that, then we would say make sure face masks are worn and ensure that there's adequate ventilation. Basically follow the advice and guidance from the HSE. Repair works. So what we need to ask ourselves is, how do we approach these works beyond health and safety measures? How will this work be done safely? How will the advice and the guidance on COVID-19 be incorporated into the whole area of health and safety? This is what needs to be thought about and what we need to ask ourselves in advance of doing these kind of works. So meeting restrictions, this has been a huge one during COVID-19. All non-essential meetings were postponed during this time. And again, it would have been the busiest time in March and April for AGMs, but like that, they had to be postponed. Now, just recently, the government has passed emergency legislation allowing cooperatives and some companies to conduct their AGMs in a virtual manner. It's a great move forward, and it would be suitable for smaller schemes, but as we know, this would be logistically challenging for larger schemes. So I suppose our advice at the moment is no public meetings until it's safe to do so. Again, it's been hugely challenging in the whole area of amalgamations and rationalisation, because as you know, group auto schemes can't hold SGMs, and they need to hold SGMs to ratify a proposal. And look, I suppose that is just the reality of it right now. The main thing is to ensure that group auto scheme boards adopt their audited accounts at board level until such time as it's safe to hold an AGM. And again, consult the government's current advice note on mass gatherings before you make any decision about whether to proceed or not with the meeting, unless it's absolutely essential. So virtual meetings, I mean, the new buzzword at the moment is definitely Zoom. I mean, I have to admit, I never heard of it. I didn't even know about Zoom until we had to use it, and we needed to use it. So again, this is the first meeting of the board of the Federation. It was a whole new concept for everybody, and they were able to embrace it, and it's worked out very, very well. There are other apps available. We ourselves, as an organisation, use Teams from time to time. And again, I know colleagues have used Google Meets, which is another app for interviews. But I'm sure there are several other apps out there, but that's just to name but a few. So our DBO LMC meetings, we're able to continue these, which was brilliant, through Zoom. Again, it was a whole new concept to everybody, but it's been working out brilliantly. Training courses, we ourselves had a training course through ICOS SkillsNet, and it's brilliant that we can continue our training throughout this whole pandemic. Interviews, from time to time we have interaction with the media, and again, this can continue so long as social distancing is adhered to and the guidance is adhered to. Site visits, we still have some site visits for the zone of contribution to take place. So here's a site visit taking place in Ballygurgeen, County Cork. Again, this can continue so long as the measures and guidance is adhered to. We also can carry out QA visits, and again, as long as the guidance is adhered to. So the COVID-19 contact tracing app, everyone should be encouraged to download the app on their phones, as it will help to identify close contacts of people who have tested positive for COVID-19. And look, this is an uncertain time. We do face many challenges ahead. Public health advice changes as we know more about COVID-19. So the Federation will provide ongoing support and communication, and we will keep group auto schemes updated. So as we're in a whole new world of pandemics, I just included this slide to show that we have a whole new communication network between the World Health Organization, the National Public Health Emergency Team, government and the HSE. And I suppose it just shows how everything has changed, and it's leaving us with a new reality that we need to get used to from here on. So for further information, you can look at our own website, nfgws.ie. We have a section there on COVID-19 updated for group auto schemes. You can access the HSE website, hse.ie. You can also go onto the government website, gov.ie, and I have a link there to the Return to Work Safely protocol, which you can access. And the Health and Safety Authority, you can access their website for a template of the COVID-19 response plan, and also to access the checklist. So thank you very much everyone for listening, and I hope you all continue to stay safe.